righty, welcome. Thank you for coming to see our presentation. Today we're going to be talking about telesupervision and the COVID-19 pandemic, how technology has affected clinical supervision. My name is Sheri Cobarruvias. I am a licensed professional counselor in Texas, and I am a PhD student at Liberty University.
I'm Dr. Braboy. I am assistant professor at Liberty University in the clinical mental health program. I also own a counseling practice called Anchored Hope Counseling in Fort Smith, Arkansas. And I have my PhD in counseling education and supervision. So welcome. So the learning objectives today is that the participants will be able to identify 3 ways supervision has been impacted by the sudden utilization of technology. Also recognize the difference between teleconference platforms for supervision, which is similar to what we use for actually doing telehealth counseling, and then determine the ethical requirements concerning the use of telesupervision and knowing what your state boards actually require for you to do as a supervisor.
All right, so we are just past a year since the COVID-19 pandemic started. The pandemic has affected billions of people globally due to infection, death of loved ones, economic loss, social isolation, change in the distribution of products and services. This has required significant modifications in how we interact with the world. Over 500,000 people have been lost just here in our country. And because of the pandemic, we've had to make it's been a significant impact around the world and has created challenges in the delivery of services, particularly mental health, counseling, and clinical supervision, which we're going to talk about here in a minute.
Yeah, we've learned a lot over the last 12 months. Generally speaking, counselors and mental health professionals were unprepared to shift to online work, especially so suddenly. I mean, it was like the brakes were slammed on, and few actually had training in providing telemental health services that addressed HIPAA compliant platforms, BAAs, confidentiality, assuring our clients' privacy and security. And yet here we were a year ago. The idea of a counseling office, it took on a whole new meaning, didn't it? Due to the virtual nature of counseling and telemental health counseling, people had to adapt really quickly. Some found ways to create an office basically within their home, and others still went to their office while conducting their services virtually from there. For newbie clients, newbie counselors, just starting off in the profession, who were just starting to get their feet wet and building a caseload and getting their feet under them. And then there were some that were just hitting their stride, and then the brakes got slammed on. So it was important as supervisors that we helped them navigate while we were trying to figure it out ourselves. And even though some of us had training in telehealth counseling, there was very little training at all on providing supervision virtually. So we're going to talk a little about that today.
Alrighty. So for our first objective is then participants will be able to identify 3 ways supervision has been impacted by the sudden utilization of technology.
So how has supervision been impacted? So online supervision is typically synchronous. It is real-time audio and video interactions between a supervisor and a supervisee who are just not in the same geographical location. What that looks like for some of my supervisees Sometimes I do triadic, and they may not be in the same place, or they may be in the same place. Sometimes when I'm working with interns and I'm providing supervision, their site is requiring them to be on site now. So they may be in the same location, and then I may be in a different location. And then it also may be asynchronous, where they send you videos of their sessions, and then you do some reviewing of that and then provide feedback on that. So supervision can be synchronous or asynchronous. Prior to the shelter-in-place orders that we had last year, many supervisors utilize an in-person model of supervision. I mean, we really didn't have anything different from that when this whole thing kind of started. But as a result of that shelter-in-place, the orders that we had, and the uncertainty of transmission of COVID, and masking, social distancing, and everything that came up from that, many supervisors had opted then to use telesupervision, use Zoom or other platforms, which we'll talk about here in a little bit. And that meant a rapid transition to telesupervision for both the supervisor and the supervisee. And honestly, most of us weren't prepared for that, as most of us weren't prepared for a pandemic in the first place. So we had this loss of in-person, face-to-face interactions, which is kind of a big deal, because that coming together and that modeling and mentoring and that aspect of what we do as supervisors, we had to find a way to be able to kind of still nurture that and fit it in. And then the potential change in the therapeutic relationship and boundary issues, those were things that we had to make sure we addressed. So benefits of telesupervision: flexibility. We were afforded flexibility. We weren't limited to just being in the session or being in the office with them. It provided us flexibility in time, space, and everything. If they were on vacation and still didn't want to miss their supervision, we were able to do that now. Wider reach to those in rural areas. So I know for some supervisors, they were able to really take on other supervisees who may not live as local, because they were able to provide supervision virtually. And then, you know, really a lot of it hasn't changed. So you really had the same benefits as you would in face-to-face supervision. You're still going to discuss cases, review recorded sessions, address administrative tasks. Are they doing their documentation? How does that look like? Assessing client welfare, supervisee performance, and professional development. So none of those things really should have changed during telesupervision. And it was really a good fit for more autonomous and kind of vocal supervisees. Some of my supervisees really thrived having a lot more autonomy, and then just checking in, doing supervision. I'm going to turn it over to Sheri to talk a little about the research.
All right. So there has been some research concerning telesupervision. Now, not so much during a pandemic, but there has been some research on the subject. In a quantitative study concerning students' attitudes about technology-based supervision over face-to-face supervision, students who were in the technology-mediated group had more positive attitudes towards the use of technology in supervision. This study found that the quality of the supervision did not differ between technology-based and face-to-face groups. In another study that I found, researchers found no differences in how supervisees viewed the effectiveness of supervision based on the method of delivery. In fact, supervisees noted telesupervision reinforced their growth as counselors. And in a content analysis study concerning the frequency of publications on the topic of telesupervision that occurred from 1990 to 2016, which that actually surprised me, those dates, at least the beginning date. I really just didn't even think about, telesupervision, any kind of electronic supervision back then. But it was found that a significant increase in publications regarding telesupervision were published from 2010 to 2016. Additionally, the study also found a congruence between telesupervision and face-to-face supervision. All right. Now we're going to talk about the effects of technology on the supervisory relationship. Okay. So with this, I mean, what do we know about the supervisory relationship already? So it provides a positive environment, supervisee growth, understanding of the process, and therapeutic alliance and gatekeeping. And what is the research telling us? Ideally, having an in-person supervisory relationship prior to telesupervision is beneficial. However, higher levels of competence in both supervision skills and telesupervision can lead to an improved rapport with supervisee compared to in-person meetings. Studies have shown no significance in decrease of supervision satisfaction or the supervisory relationship after making the switch to telesupervision, and have been found to be a viable alternative to in-person supervision. Now, I can attest to that because I had supervisees before the pandemic that I had been seeing in person. And then because of the fact that, we had to switch to telesupervision, of course, it was a seamless transition for the most part, and that seemed to work really well. Now, since then, I have had a few supervisees come on that I have actually not seen in person. We've only been doing our supervision online. And honestly, I don't see where there's really a big difference. We still have a good rapport. We still have, that relationship, that alliance. That's what I've seen so far. All right. Okay, so a review of the telesupervision arrangement. That's something that needs to be done regularly. Evaluate if learning goals and objectives are being met. Same with if you were doing this in person. Are the needs of the supervisee being met? Effectiveness of feedback, nature of the supervisee relationship. Is there support being given? Are you providing support to your supervisees? I mean, that should be a given, but, do they feel supported? Determine if telesupervision is still appropriate. And that will just depend on, how things progress. And then, of course, record any changes that need to be made. All right, so what I did, I had this idea that I wanted to find out from some of my other supervisor friends that, that have used telesupervision, or they had to make that quick switch to telesupervision. I wanted to know what they thought about this. So I asked them a few questions, and I just kind of came up with, a little quick survey. And I asked them about, has the supervisory relationship changed for them? And most of them have said that the supervisory relationship has not changed for them, and that they've been able to make that switch to telesupervision pretty well. My next question was, how has the supervisory relationship changed? And telesupervision makes it a bit difficult. This is one of the responses that I got, that it makes it a bit difficult to assess the supervisee's clinical abilities. Yeah, I can totally agree with that, as well as evaluating for compassion fatigue or burnout.
And just to jump in there, just the nature of what we've been living through, and the nature of what we do as clinicians, it's important that we assess continually, and I think maybe a little more since we're doing supervision virtually, to just assess for burnout. And really stressing the difference of burnout versus impairment with our supervisees. They may be burned out or on the fast track to it, but it doesn't mean that they're impaired, but that they will be if they aren't practicing self-care. So one thing we've implemented every supervision session that I have is, what are you doing for self-care? What did you do this week for self-care? So I am, the one way that my supervisory relationships have changed is that I am emphasizing self-care a lot more now than I was doing prior to the pandemic. And I think that's a positive change. And I do think I'm going to continue doing that afterwards, even if we don't do supervision virtually, because I think it's important that we do that just because of the nature of what we do and that vicarious traumatization that we may get by just the nature of what we do. So I just wanted to add that, Sheri. Go ahead.
No, that's great. Yeah, so, self-care is really important. And I think right now, because of the fact that, we have had to make the switch and, we're on the screen almost constantly or very frequently, that, and especially for some that are on screen all day long, I can say that, my work schedule, I'm working all day Monday, Wednesday, Friday. And so, when I'm on, it's back to back to back to back. And it does get tiring after a while staring at the screen. And I have actually, when I have a break between clients, I will get up, I will walk away from the computer, leave my phone, iPad, everything in my office, go downstairs and just chill, because it is tiring to be, looking at the screen all day. And so with this, we do have to check in more with our supervisees, provide them motivational encouragement. I think that that's really important, even if we weren't doing telesupervision. They need to know that they're being supported. And, that's not always, saying, hey, you're doing a great job, no. Okay, let's look at your strengths and what are some areas that you need growth in. And so I think that that's really important for them to see. Also, this allows time for supervisees to process how they feel about this change in communication. And I know I've talked a lot about this with my supervisees, as far as, how they're feeling about this, not just the telesupervision part of it, but a lot of my supervisees weren't in the office. They're starting to transition back to that, but they had to make that switch very quickly. And so that was hard for them. And just, one time I just had one session, like at the beginning of all of this, maybe a year ago, I just let them vent. Maybe that wasn't the greatest thing in the world for me to do, but they needed to get these things out. And so I gave them space for that. And then the last question that I asked was, do you plan to continue utilizing telesupervision once it is safer to meet in person? And the colleagues that I talked to, they stated that they would continue. Their rationale was that it's convenient, saves time, money, travel, allows for easier access to supervisees who do not live in the immediate vicinity of the supervisor. And yeah, I know that goes more into like rural settings, but I have a practice in Universal City, which is just northeast of San Antonio. And currently I have a student intern that I'm seeing that lives in Bernie. Now, if anybody knows the geography of San Antonio, Texas, where I'm at in Universal City is clear across town from where this intern is. And yeah, you might say, okay, you're in the same city or same area, why don't they just come see you? But traffic, that is the biggest thing. No joke. It would take them, especially at the time that I see them, it would take them at least an hour to get over here, an hour for supervision, and an hour to get back home. That's 3 hours out of the day being taken up. And so, yeah, I have absolutely no problem with doing telesupervision with this student because yeah, otherwise they wouldn't be able, I mean, there's other supervisors in the area, but what I'm saying is that, it just makes it that much easier for us to be able to do this. Okay, so moving on, sorry, to our second objective, what are the differences among the various telehealth and supervisory platforms? Okay. Now, if you've been doing telehealth any length of time, I think we pretty much have a good idea as to what we can and cannot use. At the beginning of all of this, I remember reading about that the Office of Civil Rights with the Department of Health and Human Services, they are responsible for enforcing certain regulations under HIPAA and to protect the privacy and security of protected health information. So therefore, normally you wouldn't use something like Skype to, talk to your clients, talk to your supervisees. That's a no-no because there is no security there. And so what happened is that I know that there were some rules that they kind of, were more lenient on than others. And so, especially for new supervisors, but supervisors that, were new to supervision, okay, they were a little lenient, and it was like, okay, yeah, you can use FaceTime, Skype, those types of platforms, but that's not something that, you should do forever. And so,
right. So they made some exceptions out of the gate just because the lack of just awareness. But once we had some education and some training, then we were supposed to and should have then transition to the more HIPAA compliant platforms that Sheri's going to share with you. Even though there aren't this is a HIPAA compliant platform to use for telesupervision, we for supervision are using the same platforms that we would use just for telemental health services.
Yeah, most definitely. And so what the important thing there is that when you're using one of these platforms, or anytime you have any kind of business that you're working with, you need to have what's called a business associate agreement. And basically, this protects if there's any kind of breach of confidentiality, any breaches in privacy. Let's see. And so when I looked at the website for the U.S. Department of Health and Human Services, they did identify some platforms that were compliant. I mean, this wasn't a endorsement or a certification or recommendation by them, but they were just identifying platforms that were appropriate to use. And so, the ones that I'm putting up here right now, we know that, with the appropriate business associate agreement that, you can use these platforms to provide telesupervision and telehealth. And if you notice, I'm putting up there things like simple practice, therapy appointment, therapy notes. And if anybody that's used an electronic health record, you may be familiar with those platforms, and almost all of, I would probably say all of them at this point, have a component of telehealth, telesupervision that you can use. And so I personally am using Simple Practice, and it was wonderful. I mean, they provided information, they kind of helped make it as seamless as possible for me to transition from in-person to telehealth. Because I had to learn this really quick. And so, I mean, yes, it does take time, but I mean, they were very helpful with that. And I assume the rest of them were too. Okay, so these are some telehealth and telesupervision platforms that are not okay. That would be FaceTime, Facebook Messenger, Google Hangouts, Zoom that's not HIPAA compliant. There is a free version and then there's a paid version. So there's two different ones. So you have to be careful with that. And Skype. Never use Facebook Live, Twitch, TikTok, YouTube, and other similar video conference platforms. All right, so I'm going to turn it over to you, Dr. Braboy.
Okay, so the next objective is determining the ethical requirements concerning the use of telesupervision, knowing what your state boards require, your licensing board. So I am licensed in Arkansas and Oklahoma. They have completely different requirements, not surprising. Sheri is licensed in Texas. I also added Florida recently. So it's important to know what your state licensing boards require. And as most of you have probably found with your boards, they changed. They made some concessions in some areas, and then in some areas they didn't. So the ACA Code of Ethics, though, so Arkansas, that's the ethical code that they follow. Oklahoma has their own ethical code, and so you've got to know the ethical code for your state. Most are the ACA Code of Ethics, and as counselors, that's really what we need to hold ourselves up to. That should kind of be our standard. So just knowing an ACA code, FCA is for supervisors. And it's important that we document and provide supervisees with ongoing feedback regarding their performance and schedule periodic formal evaluation sessions throughout the supervisory relationship. Sorry, I'm reading that. I want to make sure I state that correctly. So it's important to find ways to still evaluate your supervisees. Even though we're not meeting with them face to face, we still don't get out of that requirement per se. So we've got to be able to still provide quality feedback about their skills, their empathy with their clients, their ability to relate, their ability to build rapport, how they conceptualize the client's problems, their theoretical process, personal theory, all of that. And yet we're not sitting across from them. I don't have any supervisees that I have picked up since the pandemic started. So all of my supervisees, I already had a relationship with face-to-face that I knew prior to, unlike Sheri, who picked up some new supervisees. But it is still important, according to the ACA code, that we are able to give them this ongoing feedback and that it be substantive and that we're able to assess their abilities, their skill set, their ethical practices, their use of just multicultural awareness and all of those things. That hasn't changed. So it's important that if we're not able to do that, that we find ways that we are, because we still have that ethical obligation. Additionally, code F6B, gatekeeping, it says through initial and ongoing evaluation, supervisors are aware of supervisee limitations that might impede performance. Supervisors assist supervisees in securing remedial assistance when needed. So again, gatekeeping, as supervisors, we of course know that our license is on the line for these supervisees. And if we haven't met them, we've got to be, of course, doing the previous step, which was F6A, and this is F6B, evaluating and assessing so that we can be the gatekeeper that we need to be. And then that we are able to secure some remedial assistance when needed. We know some of these folks get through their graduate programs and they may have some things personal that they need to work on, to address. They may have some inability to integrate, like theoretically, what's going on with their clients, and they may need just some assistance. So we still have that responsibility of gatekeeping, even though we're now meeting with our supervisees. And so I think there's still a slide here where we kind of talk about, but I mean, it's just important that you as a supervisor find ways that you're able to do those things so that you can just provide the best supervision that you can. Under F5B, it's under supervisees' responsibilities. It says students and supervisees monitor themselves for signs of impairment from their own physical, mental, or emotional problems and refrain from offering or providing professional services when such impairment is likely to harm a client or others. They notify their faculty and or supervisors and seek assistance for problems that reach the level of professional impairment. And if necessary, they limit, suspend, or terminate their professional responsibilities until it is determined that they may safely resume their work. And so talking about impairment, we can't forget the importance, we've already kind of touched on it, of self-care and how the nature of what counselors are doing now has changed. Whereas before, counselors might have just had 6 clients, when they're just starting off, and now they may have a lot more because, our referrals have poured in since the pandemic. If people didn't have problems before, they really do now. They may be working from home, and their kids are now doing schooling from home, and the Wi-Fi is spotty or limited at best, or they only have one computer and they're having to share it. And just all of these added stressors, it's affected people who work in hospitality, in food service, in retail. A lot of our most of our clients, I have about a third of my caseload is teachers. It's impacted all of them. So the nature of what we do has changed because of the way it's impacted all of our clients. And so just remembering when we're doing supervision that our supervisees stress level has increased because of the stress level of their clients. And so it's so important to talk about self-care and impairment and having them be able to monitor themselves. There's some things I have them complete about every couple of months just to be aware of their own emotional and mental state, because it's important that we do that. Self-care looks a lot different now, but it's probably more important now than it ever was before. And so that's just something that's got to be addressed. I know a lot of the things that my supervisees used to do prior to the pandemic for self-care is not available now. So you have to be creative and come up with what are some things we can do for self-care. They used to go out to eat with friends. They used to go get manis and petties for even a couple of my male clients get petties, or supervisees. They may have taken vacations, gone to Mexico or something. And so a lot of the things that people used to do for self-care have had to be adapted or adjusted or just tabled for now. So helping them to find new ways to take care of themselves. It's different now, but it's, like I said, even more important than it was before. But that code F5B is their responsibility as a supervisee, but it's our responsibility as a supervisor to make sure that they're aware of it and they're addressing that. So that's what the ACA code, those are the big ones for the ACA code. And then Sheri, you're going to talk about a couple others?
Yes. All right. So I'm going to talk about the Association for Counselor Education and Supervision. And in looking at those codes, it says that the technical competencies for counselor education and the use of technology in counselor education practice and research be mindful to the state and federal laws governing electronic records and transmission, client confidentiality, multiculturalism, diversity, and contemporary ethical standards of practice. And the laws about federal, state and federal laws governing electronic records, well, I know for state, yeah, it varies state to state. So it's very important to be aware of those things. Look at what your state requires. And then in regard to the delivery of telehealth or telesupervision services, knowledge of the legal, ethical, and efficacy issues is a must and carries significant implications. You may have a client that, telehealth is not the way to go, or a supervisee that telesupervision is not the way to go. And so, we need to find either a way of seeing them in person, if at all possible. If that's not available to us, then, okay, helping them to find someone that is seeing clients and supervisees in person that you could refer them to. Because, I mean, not everybody is, you know, not eligible, but it doesn't work for everybody, basically. Counselors and supervisors are to be knowledgeable of the computer applications associated with this platform and service delivery. So yeah, what I was saying earlier was that, you know, when I made that switch to Tele-Supervision, I'll be honest, you know, I thought about it. It was one of those things that was in the back of my mind, but you know, as a PhD student, it's like, I don't have time to learn how to do this, you know? And so I just kind of put it on the back burner. I'll get to it later kind of thing. And then all of a sudden it's in my face and I have to do it. And it's like, it needs to be done now, you know, kind of thing. And so I did what I had to do. I learned this as best as I possibly could. And yeah, there were some hiccups along the way, but, you know, we were able to make it work between me and my clients. Something I noticed in my practice was that I had a lot of clients that I had been seeing in person want to be seen in telehealth, meaning that I hadn't seen them in a long time. Like there's been months or even maybe a year or two since I saw them last. And now they're asking to come and have me see them through telehealth. And it was because, you know, they're just trying to navigate their world, trying to figure out what, you know, okay, what is this going to look like? What, you know, and so I had some that were, you know, kind of in panic mode, but, you know, and they only needed a few sessions and they were good, you know, and so that happens. Okay. And then, the last thing for ACEs is the purpose of the legal and ethical standards that are for safety, security, privacy, and client for the client and counselor. Okay, so moving on to KCRA, and that has more to do with, you know, the schools and everything, with the universities and the learning environments, but that is also important too, especially when you are going to be teaching future counselors that, you know, about, you know, the counseling profession. That's also a key component, you know, now especially is telehealth, telesupervision. And, you know, one of the core areas of professional practice includes supervision and the provision of supervisory services. And this calls for doctoral students to be knowledgeable on various modalities of the supervision and use technology in supervision when appropriate. Okay, and most, I would say, well, maybe not most of us, but a lot of us are national certified counselors. And so we need to also look at what the National Board of Certified Counselors has to say about telesupervision. And of course, it says, you know, that we need to adhere to the policies of NBCC, only provide services the supervisor is qualified to provide. Know the legal regulations prior to providing services, compliance of technology, encryption security. Supervisees are notified of the risks and benefits of telesupervision. And lastly, screen potential supervisees of appropriateness of fit to receive services. And like I said before, you know, not every supervisee is going to be a good fit for telesupervision. And so, you know, that needs to be looked at and possibly referred if necessary. And then lastly, our state licensing boards. And like Dr. Braboy was talking about earlier, is that, you know, all the state boards are different. And she's licensed in different states. And so from one state to another, those regulations may be different. Now, for me, I'm only licensed in Texas. And what I have noticed is that with our rules, I have yet to find anything in our code of ethics that say anything about telesupervision or telehealth in general, you know.
Oh.
There is no there's currently no rules or regs concerning telehealth. Now, I do know that the Texas LMFT board does have established standards for telehealth. And honestly, I'm not sure if you have to be certified or just have a certain number of CEUs concerning telehealth if you're going to use that service in your practice. But right now, I'm not seeing where for LPCs in Texas that we need to have that. But I'm sure, if I had to guess, that it's probably going to be coming down the pipe in the next year or two, probably the next time they revise the rules. And that's the other thing too, is to always be up on your rules for your license. Because I know for myself, I'm pretty sure ours change every year.
Yeah.
Some little something about it changes every year. And so we need to be up on those things.
So I would love to ask the folks that are in attendance, how many of you, for those of you who are licensed, what state are you licensed in? Okay, we've got Pennsylvania, Illinois, New York, Massachusetts, California. Okay. I'm from Southern California originally, so I always get excited. Yeah, so it's important. Like I said, I'm licensed in Oklahoma and Arkansas. Southern Cal, yeah. I'm from Anaheim, so hey. But yeah, it's important to know. So Oklahoma is a lot like Texas in the fact that they had nothing about telehealth. Arkansas had very set guidelines about telehealth. And so I already had training. They required a course that you had to take, and then you had to submit a written kind of exam. And it was like probably, I don't know, 15 to 16 pages you had to write about telesupervision, showing if you had a client, what all did you need to know? You needed to assess them. You needed to know a counselor in their area. You needed to know who to reach in case of an emergency, So we had to have all this training. And then we had to actually have a specialization with our license, with the state licensing board to provide telehealth. And so I had done that previously, but there still was nothing about telesupervision. And so we found ourselves with supervisors with no telehealth training, trying to do telesupervision just over FaceTime or Skype or whatever. They weren't really prepared. And initially it was allowed because we were in a pandemic. But then it was important to kind of have some awareness of, HIPAA compliant platforms. It was a little different initially because I don't, in supervision, I don't know my supervisees, I don't know their client names. So it's not as confidential, but we are discussing client issues and things like that. So it's still important that you do have that confidentiality and that security. And it's important to kind of assess for that. Just like with telehealth counseling, it's always important too to say, okay, well, if we get disconnected, if a storm comes through, because Texas and Arkansas, we got hit with this freak snowstorm not too long ago. So internet was affected, but even if not, if it's just a windy, I live in Tornado Alley. And so, if we lose connection, then we're going to do this as a backup. So just all those kinds of little things too, that you actually get in your training for telehealth is important to just remember to do when you're doing telesupervision. But I think for me, the biggest thing that I really would want to impress is the importance of assessing and the gatekeeping aspect of it. You can do synchronous or asynchronous. You can still review their tapes. And I think it's maybe even more important to do some of those things now, since you don't get that feel for them because you're not in their space. I have one supervisor I've had in the past. They kind of missed some social cues. They might have been on the spectrum a tad. But I knew that because I met with them in person. And I think I might have missed some of that if it was virtually. And so we do have that as a disadvantage. And it's important to be able to try to find ways to assess for that. and then give them the help and support that they need. We want them to be successful. And then really do that assessing continually about self-care. Are they doing what they need to do? Like Sheri talked about getting up. I actually got in a little bit better shape and lost some weight over the pandemic because I started cooking at home more. I would get up and actually take a walk 1 to 2 miles a day if I had a break in the action between clients and grading. And so I started implementing self-care early on when we first transitioned to virtual. And I think it's important just that you may not have to model that necessarily for your supervisees, but that you encourage that nonetheless. So I think that's our last slide. So are there any questions, or are there things that are going on within your states that maybe we didn't even address that may be an issue that we can kind of hear about? Kristen, I see a hand. Hi.
Hi. So here's a question that perhaps it's not a question, but something that we're trying to deal with is we have students for practicum and internship who they want to go to a site, but the site is remote.
Yes.
And so we're kind of struggling with, okay, but who's going to do the supervision? Well, the licensed supervisor is licensed in Pennsylvania, but residing in New York now.
Yes.
So
I'm seeing that. Yes, I teach internship. I have 3 sections of it for Liberty, for a clinical mental health program. And I'm seeing that exact scenario. In fact, one of my students in the fall, she was like in, I don't know, North Carolina, Georgia, somewhere. And when I call her supervisor, she is in St. Louis. And I'm like, how are you assessing my student? Like, yeah. And then my student is only working virtually. Now, we required all of our students, we created a training at Liberty when this all happened. One of our faculty members had actually just published a book on telehealth before the pandemic, like how to, a word from God. She just did that, and she and her husband. So we created, because several of us were already trained in telehealth and using it some with our practice. I was doing it minimally. I really started it because I had a lot of high school seniors who were going away to college within the state. And that's another thing doing telehealth. You've got to know, you've got to be in the same state, and your client has to be in the same state that you're licensed in. You can't just go across state lines, but that's telehealth. And that we didn't bring that up because it's not as important for our topic. But we have a lot of students, and they have to do the training, the telehealth training, in order to be able to do it at their site and then show the certificate. Mm-hmm. Whether their supervisor does it or not, we don't expect them to, but we just really try to have a conversation with that supervisor. Like, how are you assessing our student? Are you meeting with them weekly? That's a requirement for them to have 1 hour supervision every week. It makes it questionable at times. I mean, I have some students, honestly, I taught 2 classes last night, and one of my students, I'm really suspicious of whether she's actually getting the supervision that she's not getting the supervision she needs. I don't know that she's getting the supervision that, I don't know. Yeah, you know what I'm saying though, but it's definitely tricky. It just, we have to expect that the supervisees, when they agree to take on these students as an intern, that they're going to meet the requirements. And we're super clear. We send them a copy of the internship handbook. I send an introductory email and follow up during the semester. And I just hope that they're being, honest and ethical. I don't have control over the supervisor, but sometimes the students are honest about the lack of whatever's missing from supervision. And then we encourage them to have it, maybe get a different supervisor, one who's more available or accessible to them. But it's definitely happening more, especially when there are companies like community mental health agencies or whatever that are owned and operated in one state and they have several different locations. That is happening more and more. But I don't think they have a very good feel for what's going on with that student. I usually try to encourage the student to get somebody that's there on site for a lot of reasons. One, they're accessible. You know, if you have a question about a treatment plan, or if you have a question about a session you just finished with somebody, you need to have somebody you can go to and have those conversations. That was a long answer. I hope that answered it though.
It's just a difficult situation. And so like what we're finding is the licensed individuals are remote, and then people who are physically there to be able to go to right away are not licensed. So technically the supervisor, the head supervisor, has to be the one that's licensed.
Right.
It's just it's a very confusing on how this is all transpiring. And
Right.
when you've got students who you're already like,
Right.
questionable about, and they
Right.
need extra support.
Right.
Like, I just really don't feel that is, meeting their needs or the client's needs, and
Right.
which scares me. But then how do you also say, well, you need extra support, so because you can't find a site, you're not able to graduate. You can't continue the program. Like, so
Right.
we're just stuck between a rock and a hard stone.
I agree. I usually try to push them to get a different site. That's what I've done. You're not getting the support you really need to get through this. And I've had several this semester alone that switch. It's very hard. Yeah, we have a lot in rural areas here too, and it's very limited. But usually I can't imagine there's nobody at their site that's licensed that can just give them an hour a week or even a half an hour a week, and they can do the other stuff remotely. But, because they need to be able to evaluate them. And if they're remotely, how can they evaluate the services they're providing to clients? They don't know. They don't see it.
Mm-hmm. Yeah.
And that's where we kind of wondered about maybe requiring more feedback from clients, like, anonymously.
Yeah.
Can you please provide, every other week feedback, and then our students have to submit it. We're just trying to figure out how to get more feedback on how the students are actually doing.
Right. Yeah, we have the site supervisor do a midterm eval and a final eval. And one of my students got a really poor evaluation, but the site supervisor had never been in the office. She really didn't have a good assessment of how the student was doing. And I don't think the student was doing as poorly. Mm-hmm. Anyways, it's tough. And I could do a presentation on just, supervising students through this situation, because that's something we've talked about as a faculty, and we have a lot of faculty. So somebody put a question up here too. How do you know when it's no longer a pandemic challenge and the supervisee struggles? Well, the truth is you don't really know if it's whether it's still a pandemic challenge or not. But regardless, it's important to just it depends on if it's a student, and this is a supervisee. So you may just have to encourage them to get their own counseling. It's no different than anything else. If you kind of assess there may be some burnout or just an issue, like it's important that you as the gatekeeper and you as the supervisor, then it goes back to that one ACA code, help them find a way to remediate that. And you may have to have just a sit down, come to Jesus kind of chat with them and say, there's obviously a struggle, and we've really, our goal between us, this relationship here, the supervisor, is for you to help you be successful. And right now it doesn't appear that that's working for you. We've got to find a way for that to happen. So suggesting counseling, suggesting maybe cutting back, or having them really focus every week on some self-care issues. And if there's still some problem, then you may have to suggest some kind of remediation. Maybe they need to take another course. Maybe they need to, do some other things. But that's our responsibility as supervisors to make sure, whether it's a pandemic or not, that we recognize that and then address it.
Mm-hmm.
As do we, but we aren't actually seeing the supervisee. How fair is it to assess the student? Yeah, I agree. And how do you manage supervision, disciplinary action through telehealth? Sheri, feel free to jump in. I don't want to monopolize. Are you meaning supervision, disciplinary action from you, the supervisor, Leanne, or through?
Like if I work in an agency that has productivity expectations and note timeliness expectations, and sometimes if supervisees are falling behind consistently and not following plans and not turning in their notes, we may have to do disciplinary action. So what's the best way to manage that in a virtual setting?
I don't think it's really going to be any different than it would be face-to-face. Those things still have to be done. So you may just have to set some expectations that need to be met.
Mm-hmm.
And if they're not met, then there's got to be, some consequence for it. I don't think that would really be any different. Sheri, do you have an answer for that?
I'm thinking the same thing that you had mentioned. I don't see where it would be any different. It's just that you would be going over maybe a remediation plan over telehealth rather than in person, because the expectations, I don't know, maybe they did change for telehealth. I don't know at your agency, but if the expectations are there that they're supposed to do a certain thing and they're not, then yeah, I think it would be totally appropriate to provide a remediation plan, whether it be in person or telehealth.
Mm-hmm.
All right, it looks like we are out of time. Thank you, everybody, for your conversation and your questions. We hope it was informative. It's something that Sheri and I both, as supervisors, have noticed the change in the last year. So we were hoping we put together some information that was helpful to you.
All right, thank y'all. Yeah, this is something that is really important, and I think it's going to be something that we're going to be seeing more of moving forward.
Yeah. All right, thanks so much.
Bye-bye.